Hello, and welcome back to our next episode of the Hormone Cafe. I want to talk to you about different hormone profiles, what hormone profile you could possibly have, and what those hormone profiles mean. The three hormone profiles are, one is what I call the low-low. And when we're thinking about hormone profiles, I'm talking about your estrogen and your progesterone. So low-low means that your estrogen and progesterone are low. And remember that when we make estrogen, we actually make estrogen the entire cycle. And our estrogen levels go up during ovulation. And then after ovulation, our ovaries then make estrogen and progesterone. So when we're thinking about estrogen, we're thinking about the whole cycle, and we're thinking about progesterone, we're only thinking about that luteal phase after we ovulate. So we have our low lows, meaning that your estrogen and progesterone are just low the entire time. And then we have our estrogen dominant, low progesterone profile, and then we have our progesterone dominant, low estrogen profile. And those three profiles are all very different, and the way they manifest can be different, and the way we treat them can be different. So I highly recommend you get your labs checked, you check your urine hormones, you know what hormone profile you have so that you know how to treat it, and you know what the different signs are for the different hormone profiles so that you can kind of know what your own hormone profile is. I always recommend that you get your hormones drawn on cycle day 3. So you want to be getting at least estrogen, progesterone, FSH, LH, testosterone. And then you also want to draw your hormones 7 days after you ovulate. That's when your estrogen and progesterone should peak, but that is dependent on the size of and the length of your luteal phase. For example, if you're a person who has only a 10-day luteal phase, you're going to want to get your hormones drawn 5 days after you ovulate or 5 days before you start your period to make sure you're hitting that peak. And then when we look at your hormones before, during, and after ovulation, we can help map out your hormone profile to see what you are, and then how do we help you. So the first hormone profile is what I call low-low, meaning your estrogen and your progesterone are low. And hormones come from your ovaries. So that means that if everything is low, that our follicles are not developing well because it requires estrogen to develop a follicle, and a follicle has an egg inside, and that we're not ovulating well. And then if we're not ovulating well, our ovaries are not making progesterone and estrogen well in that luteal phase. If you're a person with a low hormone profile, some of the symptoms from a mood standpoint, you can run really depressed and just have a low stress tolerance and a lot of brain fog, a lot of poor memory and focus, and a lot of sleep disturbance. People who have everything low fatigue really easily, have a really low stamina, and just feel like they're burnt out all the time. And that when they exercise, they just feel exhausted afterwards. And as far as your period is concerned, symptoms are you have really light periods, or you have really long cycles, or you skip cycles because it takes a certain amount of estrogen in order to trigger ovulation. So if you have really low estrogen, then you'll ovulate really late. And if you're ovulating late, then that can give you a really long cycle. And then if you have low hormones in your luteal phase, that can cause a luteal phase defect. So you can have a short luteal phase, you can have symptoms of recurrent miscarriage, poor cervical mucus, thin uterus lining. These are some of the things that we see in our low hormone profile. And then as far as vasomotor and thermoregulation symptoms, sometimes we can have hot flashes, night sweats, or cold intolerance, or feeling cold all the time because we don't have estrogen to help with that blood flow. From a sexual standpoint, we can have low libido, a lot of vaginal dryness, pain with sex, and recurrent UTIs and bacterial vaginosis infections because low estrogen at the vaginal level can disrupt our vaginal microbiome. And then it can also contribute to things like dry skin, hair thinning, brittle nails, muscle aches, because again, estrogen really fuels blood flow in our circulation. And so if our whole body is not seeing proper amounts of estrogen, it affects all the cells in our body. And then long term, if we're low estrogen, it really gives us heart attack and cardiovascular risks. That's why women have fewer heart attacks than men, because we have more estrogen on board. So if we have less estrogen, that puts us at risk of having heart issues, and it also puts us at risk of having bone issues, which is osteoporosis or osteopenia down the line. It also puts us at risk of cognitive changes over time because of the reason that low estrogen gives us a lot of brain fog. So how do we get into this position where we're low? Sometimes there can be things in our environment that are really suppressing our hormone production. So for example, our FSH and our LH in our brain talk to our ovaries. And if our brain hormones are low, then our ovary hormones are going to be low. That's called hypothalamic hypogonadism, meaning that your brain hormones are low and your ovarian hormones are low. And a lot of times those can be caused by anything that is suppressing our brain. So for example, if we're not nourishing ourselves well, if we're not eating enough calories, if we're not getting a diverse variety of nutrition, then our body is not able to absorb and process the nutrients that it needs for the building blocks of hormones. If our gut is really, really off, we can see that low hormone profile where our gut just cannot absorb the nutrients it needs to build estrogen and progesterone. Or if we're chronically stressed, if we're stressed all the time, cortisol levels will suppress our hormones because our body only makes hormones when we are nourished, when we're happy, when we're safe. If we're really stressed and we're in fight or flight all the time, our body will respond by suppressing our hormone production. So chronic stress can really contribute to that low hormone profile. And then other things that just cause stress on our bodies, for example, if we're postpartum, if we're breastfeeding, that elevated prolactin can suppress our hormone levels. Or if we've just undergone surgery, something that's very traumatic or stressful to our body, that can also cause your hormone profile to be low. And then sometimes in perimenopause, we'll have that. Or if we have ovarian insufficiency or early menopause, all those different things can put us into that low state. So if you're a person who has a low hormone profile, what do you do about it? And one thing that you really want to make sure is that you are nourishing yourself. You're eating breakfast, lunch, dinner. You're not fasting for very long. You're not the kind of person that snacks throughout the day, because you really do need the calories and the nutrition. If you're snacking, you're literally not getting enough calories and you're starving your body. That starvation will be a form of stress. And if your body's stressed, then it will suppress your hormone production. So you really want to make sure you're being nourished. The other thing that you want to make sure is that you're not working out really, really hard. Because if you're working out really hard, you can burn off the estrogen that your body is trying to save up. People who have a low hormone profile do much better with gentle workouts. So we want to be doing yoga, bar, Pilates. This is not the kind of hormone profile where you can be doing HIIT and spin and killing yourself at the gym, because then you're just going to feel low and exhausted all the time. And then when we think about our supplements, we want to be taking things that support both our estrogen and our progesterone production. So that's our omega-3s, our Vitex or our chasteberry, and our magnesium, those kind of supplements. And then the second hormone profile is our estrogen dominant hormone profile. And estrogen dominance can go hand in hand with having low progesterone. Our hormones always want to be in a specific ratio. And so if those ratios are off, that's what gives us a certain hormone profile. When we think about estrogen dominance, these are people who we check their hormones and their estrogen, it's really high in their follicular phase, it's really high when they're ovulating, and it's really high after they ovulate. And then in relation to that, your progesterone can be really, really low. So what are some of the symptoms of that estrogen dominant hormone profile? This can be a lot of anxiety, a lot of irritability. It can also be associated with a lot of mood swings and emotional reactivity, or just feeling like you want to snap. It can really be associated with headaches or migraines and cyclical depression, not consistent, but when your estrogen is going up and it's really coming back down and then going up and really coming back down, that can put you in these high energy and then really low energy cycles. When we think about our periods, people who are estrogen dominant tend to have really heavy periods, lots of clots coming out. Their cycles can be a little bit shorter, and it can also be associated with mid-cycle spotting or spotting before your period. It's associated with having a lot of PMS type symptoms and having a lot of mood symptoms right before our period. It's associated with having breast tenderness. And then one thing that we need to know is that estrogen can grow fibroids, it can grow polyps, it can grow endometriosis. So if you're the person who has really significant pain on your periods, then we definitely want to look into your hormone profile. Sometimes people who are estrogen dominant get a lot of breast swelling and pain and fibrocystic breast changes and increased breast density. They tend to have more bloating, more water retention, more weight gain in the hips and thighs, and then more joint inflammation. And then it's also associated with poor sleep if you're estrogen dominant, because it can really affect your mood and that can affect your sleep. And then people who have estrogen dominance, they tend to have a lot of acne, especially around the jawline. They can have melasma or skin discoloration, and then hair thinning or shedding can be related. Also, it can be associated with things like constipation, slower gut motility. So when we think about why are you estrogen dominant, two of the humongous things that really fuel estrogen dominance are eating too many carbohydrates relative to your protein ratios, and then eating too much sugar, because low quality, high glycemic index carbohydrates and sugar can really fuel our estrogen production. So if you are a person who has symptoms of estrogen dominance, you really want to look at what you're eating. Make sure that you're getting at least 20 grams of protein per meal and around 80 grams of protein per day. And if you're working out, you're going to need even more protein requirements. And then you want to make sure that you're always eating a carbohydrate paired with a protein, because the more carbohydrates you're eating and the less protein, that's going to fuel your estrogen dominance. And if you're an estrogen dominant person, you never want to have sugar or treats by themselves, and you really need to lower your sugar intake. I had a patient who was eating a lot of white bread and tofu and soy because she was vegan, and we checked her estrogen and it was sky high, through the roof all the time, and she had horrible anxiety. And we looked at her diet, and because she was vegan, she just wasn't getting enough protein. And so we brainstormed together all the different foods that have high protein in them that you could eat when you're vegan. And I had to really lean into those foods. In one cycle, her hormones were completely transformed. Her estrogen was dramatically better. And in 2 cycles, she was pregnant. So sometimes just literally knowing what your hormone profile is, know how to eat for your hormone profile, can be extremely powerful. So if you're a person that has high estrogen or estrogen dominance, you're also going to need to be a person who works out a lot, because you want to make sure that you're burning off your estrogen. So you're the kind of person, you can do HIIT, you can do spin, you need to be getting to the gym or exercising or moving your body in some way at least 5 days a week, because you really need to make sure that you're circulating, detoxifying, and processing and metabolizing your estrogen. You also need to keep your liver really healthy and your gut really healthy, because estrogen is metabolized in the liver. So you really want to be careful of alcohol and Tylenol and other things that are metabolized in the liver. And then you really need to make sure that you're having really excellent bowel movements every day, because estrogen is detoxified in the liver and in the gut. You don't want to be backed up where you're just recycling that estrogen into your body. Another thing that you want to make sure is that you're eating enough fiber, because a lot of estrogen recirculation issues come from the gut, where your gut is making proteins that are just recycling estrogen right back into your bloodstream. And those proteins are improved by fiber. So our biggest sources of fiber are whole grains, vegetables, and beans. So when we're thinking about our sources of fiber, we really want to think about a lot of different fiber diversity throughout our day. So are we eating fruits and vegetables? Are we eating high quality grains? Are we eating things like flax and chia seeds and beans to really round out our fiber and make sure we're getting enough fiber to have excellent bowel movements and help our body process and metabolize estrogen? And then The third hormone profile that we think of is our progesterone dominant hormone profile. And progesterone dominant goes along with having a low estrogen. And one really important thing about getting your hormones checked like this is if you're following a nutrition plan, following an exercise plan, following a supplement plan, you want to make sure that it's in line with your hormones and never fighting it. For example, one thing that I see a lot is sometimes patients are just thrown on progesterone, for example, and they just take progesterone. However, if you're a person who has low progesterone, low estrogen hormone profile, you do not want to just be taking progesterone because now that's going to throw off your hormone ratios. You need to be taking progesterone and estrogen with it. If you're a person who has estrogen dominance, then yes, then you're a person who can tolerate taking progesterone. So if you're a person who's progesterone dominant and you're low estrogen, then you definitely do not want to be taking progesterone because it's going to throw off your ratios way, way worse. So symptoms of progesterone dominance or low estrogen are feeling sedated or just drugged, having horrible brain fog and bad concentration, having a lot of low motivation, just depression or emotional flatness, and then also having vivid dreams or nightmares. When we think about sleep, these are people who have excessive sleepiness, lots of daytime fatigue, and then difficulty waking up in the morning. It can be associated with having low blood pressure, lightheadedness or dizziness, and then also some fluid retention and bloating. These are sometimes people who have increased insulin resistance, increased appetite or cravings for carbohydrates, weight gain without changing anything that you eat. These tend to be women who feel warm, flushed, run high temperature, and then have heat intolerance. And this is also associated with constipation and nausea because having a low estrogen relative to your progesterone can be really nauseating. It can also cause having a lot of breast tenderness or fullness, decreased libido, and vaginal dryness because that low estrogen also gives us vaginal dryness. So when we think about how do we improve our estrogen levels, we also want to think about being nourishing. So the same things apply for that low hormone profile. We want to make sure that we're nourishing ourselves. And then these are people who need to do a moderate amount of exercise. Not too low, not too high, 15 minutes of cardio, 15 minutes of weights, 3 to 5 times a week, where enough to support blood flow to our ovaries, where our ovaries are making proper amounts of estrogen, but not so much exercise that we're really burning them off. And in women who tend to be progesterone dominant and low estrogen, we really need to focus on ovulation, because if you have low estrogen the entire time, then we really want to make sure that you're having enough estrogen in order to ovulate properly. So we focus on nutrition. We focused on having a really balanced exercise regimen because we want to make sure that we're not burning off our estrogen and that we're actually building it up. And then we really, really need to manage stress because stress will suppress your estrogen levels. So it's extremely important to know where the stressors are in your life and be able to manage them and have active steps to bring your stress down. And sleep is a really important part of that. We really need to make sure that we're getting enough sleep so that our bodies are stressed. So we want to be nourished and then low stress and have moderate exercise, not killing ourselves and not super gentle or doing nothing. And then when we think about our supplements, we're going to think about supplements that promote our estrogen production. So that's definitely going to be our omega-3s and our oils and our fats and things in those families. And then other things that we want to think about are if we have really low estrogen, then we can definitely supplement with bioidentical estradiol if that's needed, if our estrogen is so low. But you definitely do not want to take progesterone by itself if you're a low estrogen or if you're a high progesterone dominant, low estrogen hormone profile. So things to think about are know kind of how you feel, know what your period pattern is, know what your mood symptoms are, know what your vaginal health is, know what your gut health is, And if you're a kind of person that fits one of those hormone profiles, just really make sure that you get your hormones checked and tested so that you know your hormone profile, so that you can eat to your hormone profile, you can exercise to your hormone profile, you can take the proper supplements, and you can take bioidentical hormones in the proper format if needed. I see a lot of people, for example, who they're diagnosed as low progesterone, but actually their progesterone was just checked at the wrong time, because your body only makes progesterone after you ovulate. So if you check progesterone before you ovulate, of course it'll look low. So I see a lot of people who get their progesterone checked at the wrong time, and then they're put on progesterone at the wrong time or in the wrong ratio relative to the rest of their hormones, relative to their estrogen, and it really throws them off and makes them so much worse instead of making them better. Estrogen, for example, will thicken and grow your uterus lining and promotes blood flow, whereas progesterone is a stabilizing hormone. So if you're just taking too much progesterone and not enough estrogen, it can really thin out your uterus lining over time. That's why it's so important to take hormones for your body and make sure that it's measured and make sure that you're taking the right hormones in the right doses for your body. So if you're on bioidentical hormones or you're on supplements, you always want to get your hormones rechecked to make sure you're moving in the right direction, always making things better and never worse. And then other things to think about are supplements. You just want to make sure that your supplements are proper and appropriate for your hormone profile. Another thing that I'll see a lot is that a lot of people come in on things like DIM, DIM, which is a supplement that helps us metabolize our estrogen. But DIM is really excellent for people who are estrogen dominant. However, you do not want to be on DIM if your estrogen is low. So sometimes I see people coming in on something that's bringing their estrogen down and they're already low estrogen. So please make sure that your eating, your nutrition, your supplements, your bioidentical hormones are always in line and promoting the natural support of your body and never making it worse. If you have any questions about your hormone profile, please come get your hormones checked. I would love to help you. I'm very passionate about making sure that every single woman feels amazing every day and is empowered and knows how to eat and exercise and take supplements specified to their hormone profile, where we can have regular periods, no PMS symptoms, amazing mood, and feel great every single day. So if you have any symptoms like that, please do not give up on your body. Make sure that you're always advocating for yourself so that we can make sure that you are feeling excellent in the body that you have every day, all day long. Thank you so much for joining us on the Hormone Cafe today. Tune in for our next episode.